It's August of 2024. No better time to get a crash course on pipeline drugs in the retina field. VEGF inhibitors are what's commercially available, and they're injected into the vitreous cavity and act by binding extracellularly to the VEGF ligand to prevent receptor activation. VEGF-A is the workhorse in angiogenesis, and it's the one common target among all commercially available anti-VEGF products. But other VEGF subtypes include VEGF-B, C, and D, as well as placental growth factor. Opthea's investigational product, OPT-302, is currently undergoing phase 3 clinical trials to assess its effectiveness as a VEGF-C and D inhibitor when in combination with either ranibizumab or aflibercept. These are all extracellular approaches to block VEGF activation. But what if we could block receptor activation through an intracellular mechanism? That's exactly how tyrosine kinase inhibitors work, and there are a few companies in this space that are looking at this approach. Ocular Therapeutix has a phase 3 clinical trial program currently ongoing called the SOL-1 study, which is evaluating the effectiveness of its biodegradable hydrogel implant, which elutes axitinib, a potent tyrosine kinase inhibitor. Eyepoint Pharmaceuticals is another company in the TKI space, currently evaluating its proprietary product, EYP-1901, an intravitreal sustained-release polyvinyl alcohol implant, releasing another potent tyrosine kinase inhibitor, vorolanib. Finally, ClearSight Biomedical is another company in the TKI space, evaluating tyrosine kinase inhibition through a suprachoroidal approach with axitinib in its phase 2b clinical program, Odyssey. Stay tuned to part 2 of this video, where we'll be discussing gene therapy and its role in the retina pipeline.